Hello guys, today we'll be starting our series of lectures on the lower limb. Before we discuss each and every topic in detail, I'd just like to give you an overview of the lower limb. Okay, so basically what I'll be discussing is, the all the muscles in the lower limb and their nerve supply, and a few details on the fascia lata, that is the deep fascia of the thigh. Now, from your exam point of view, um, you don't need to know the origin insertion of each and every muscle. Okay, so my goal or my objective through this video is to give you a basic idea of what all muscles are present in the leg, and later on in your dissection classes, or if you have the 3D anatomy app, you can just try and identify these muscles. Okay. um, okay, so before I start with that, I just give you a basic overview or basic idea, basic osteology of the pelvis bone. Okay, some of people find this hard for some reason. The See, if you're reading the pelvis bone through a book, you won't understand anything. If you have a model in front of you, you can easily study the pelvis bone. Because some aspects of the pelvis is required in our discussion today, I'll just briefly run through the important features of the pelvis bone. So here we have the pelvis. Okay, so we all know the basics. Yeah, it has three parts: the ilium, ischium, and the pubis. Okay. Now, other important landmarks in the pelvis bone are, the first one is the iliac crest, and that here is a superior structure here, iliac crest. Okay, and in this diagram, and iliac crest. Okay. The next important feature we must know is the anterior superior iliac spine. So I'm circling it right now. The anterior superior iliac spine, and the anterior inferior iliac spine. Okay, so the anterior superior iliac spine, the anterior inferior iliac spine. Similarly, in the posterior view, I forgot to mention, this is the anterior view and this is the posterior view. In the posterior view, we have similarly the posterior superior iliac spine. Okay. Next, this here is the ischium. Okay. So this structure here is the ischial spine, and you see this roughened portion here, that is the ischial tuberosity. Okay, so these are the basic stuff you need to know about the pelvis. And one more thing, the structure where they meet, this is called the pubis, pubic, and the cartilage in between, this white cartilage you see, is the pubic symphysis, and just lateral to that you see this tubercle, this is called the pubic tubercle. Okay, so this is the basic the basics of the pelvis bone. Now, moving on, let's just begin with the basics of the leg. Okay, so let me just get this out of the way. Okay, so the leg. Now we all know the leg has what? A thigh and the leg, or the lower limb has the thigh, leg, and the foot. Okay, now the thigh can be divided into three compartments. If this is medial, this is the lateral. We can divide the thigh into an anterior, posterior, and medial compartment. Okay, anterior, posterior, and the medial compartment. Then the leg can be divided into an anterior, posterior, and a lateral compartment. Okay, so in this discussion, I'll be talking about each and every muscle present in each compartment of the thigh and the leg. Okay, you just need to know the names, but I've included the tables from your Vishram Singh textbook so that you can go through them right now, and just have a brief idea. Okay, so let's begin with the anterior compartment of thigh. So in simple words, the anterior compartment of thigh has two muscles, the quadriceps femoris and the sartorius. Okay, now quadriceps femoris, the word quad means four, so it has four muscles. The four muscles are the rectus femoris, the three vastus muscles, vastus medialis, vastus intermedius, and the vastus lateralis. Okay, so the quadriceps femoris has four muscles, the rectus femoris and the three vastus muscles, and other than that we have the sartorius muscle. Okay, so these are the muscles in the anterior compartment of thigh. Now, and see, the origin insertion, as I told you, is not that important, but then for 1 mark questions they may ask like the muscle that arises from the anterior superior iliac spine, or the muscle that arises from the anterior inferior iliac spine. So just remember, the anterior superior iliac spine gives rise to the sartorius muscle. Okay, anterior superior sartorius. Okay, and the anterior inferior gives rise to the rectus femoris. Okay, so this is all you need to know about the origin insertion. And the nerve supply, muscles in the anterior compartment of thigh is supplied by the femoral nerve. Okay, so anterior compartment of thigh, if someone asks you what is the nerve supply of the vastus medialis, just say femoral nerve. Okay, that's the basic. Now I've included the table. You can like pause the video right now and just have a brief read through of the origin insertion nerve supply. And actions of these muscles are not important. The individual actions are not important when we study a joint, example the knee joint or the hip joint, like which muscles carry out a particular action of the joint. That's when we have to know the actions. So right now just knowing the names and nerve supply is enough. So we've discussed the anterior compartment. Moving on, the medial compartment. So the muscles in the medial compartment, basically they take origin from the pelvis. Okay, from part of the pelvis. So let me just, from the pelvis, and they are inserted into the medial side of femur. So what would their action be? Is basically adduction. Okay, adduction means bringing a part of the body closer to the midline axis. So we can remember the medial compartment of thigh is involved in adduction, and hence it has 3 adductor muscles: the adductor magnus, the adductor longus, and the adductor brevis. Now apart from the 3 muscles, we have 2 extra muscles, and that is the pectineus and the gracilis. Okay, so just remember the names: 3 adductor muscles, adductor magnus, longus, brevis, and 2 extra muscles, the pectineus and the gracilis. Okay, now in this diagram that I've included, on the medial side itself, these muscles have a particular arrangement. Okay, now the orientation is anterior, posterior, superior, inferior. So the 3 layers, we have an anterior layer, middle layer, and a posterior layer. Now in the anterior layer we have the pectineus, gracilis, and the adductor longus. Okay, so 3 muscles in the first or the anterior layer, 1 muscle in the middle layer, and that is the adductor brevis. Okay, and finally in the posterior layer we have the adductor magnus in the posterior layer. Okay, so these are the muscles in the medial compartment and their arrangement when viewing from the medial side. Now the nerve supply. So all these muscles are supplied by the obturator nerve. In simple words, the nerve supply is the obturator nerve. Now if you want to go one step further, we can say that the obturator nerve has 2 divisions: the anterior division and the posterior division. The posterior division supplies only 2 muscles, and the rest are supplied by the anterior division. Now the posterior division supplies which 2 muscles? The gracilis and the adductor magnus, or the adductor, to be specific, the adductor part of adductor magnus. Why I'm saying this is because the adductor magnus is a huge muscle, and it has 2 heads. It has an adductor head and an ischial head. The ischial head of adductor magnus is included in the posterior compartment, and the adductor head part is included in the medial compartment, and only the part of the adductor magnus included in the medial compartment is supplied by the obturator nerve. Okay, so remember, it has an anterior division. The anterior division supplies all the muscles except 2 muscles, which are the gracilis and the adductor part of adductor magnus. Okay, now the pectineus has a dual nerve supply. Now that's because it's the way it is placed in the body is basically, it is at the junction of the medial and anterior compartment, so it has nerve supply from both the compartments, and that is the obturator nerve and the femoral nerve. And similarly we can say the adductor magnus also has dual nerve supply. It is supplied by the obturator nerve and the nerve of the posterior compartment, which we'll discuss in the next in a few minutes. Okay, so these are the muscles. I'll just go through again. The 3 adductor muscles, pectineus and gracilis. Nerve supply is the obturator nerve. Now I've included the table. You can just pause the video right now and go through them. Moving on, the posterior compartment of thigh. Now Muscles in the posterior compartment of thigh, these are called as the hamstring muscles. Okay. Now the condition for a muscle to be called a hamstring muscle is number one, its origin must be the ischial tuberosity, and number two, they must be inserted into the bones of the leg, that is the tibia or fibula, and they must be supplied by the tibial part of sciatic nerve. So I just mentioned a bit about the sciatic nerve. The sciatic nerve is the thickest nerve in your body, and it is actually two nerves enclosed in a common connective sheath. Now the two nerves are the tibial nerve and the common peroneal nerve. Okay, so for a muscle to be called a hamstring muscle, that is, they must have origin from the ischial tuberosity. They must be inserted into the bones of the leg, and nerve supply must be by the tibial part of sciatic nerve. Now, what are the muscles that are included in the hamstring group? Now, these are the two semi-muscles, the semi-tendinosus and the semi-membranosus. Then we have the biceps femoris, the long head of biceps femoris, and the ischial head of adductor magnus. Okay. Now, there's a muscle in the posterior compartment that is not included in the hamstring group, and that is the short head of biceps femoris. Now, if someone asks you why the short head of biceps femoris is not included in the hamstring group, it is because it is not supplied by the tibial nerve. Instead, it is supplied by the common peroneal nerve, and hence it does not justify the conditions, and hence is not a part of the hamstring muscle. Okay, so again, I'm just revising. Muscles in the posterior compartment, we have 5 muscles, and 4 of them which are included in the hamstring group, and these are the semi-tendinosus, semi-membranosus, the long head of biceps femoris, and the ischial head of adductor magnus. And just note, the short head of biceps femoris is present in the posterior compartment, but is not included in the hamstring group. Moving on, the adductor part of adductor magnus, okay, that is also an exception. We can say it is not part of hamstring group because it is, first of all, it is present in the medial compartment, and second, it is not supplied by the tibial nerve. Okay, so that is justified. Now, yeah, I've included the origin insertion. Now, before I talk about the linea aspera, I'll just give you this brief revision of what we've just gone through. So this is the thigh. We've divided into an anterior, posterior, and medial compartment. Oops, medial compartment. Okay. Now the nerve supply of the anterior compartment is the femoral nerve, and the two muscles are the quadriceps femoris and the sartorius. Now the medial compartment has 3 adductor muscles plus PG, pectineus, and the gracilis. Okay, and this is supplied by the obturator nerve. Okay, and finally the posterior compartment has 4 hamstring muscles and one muscle that is not included in the hamstring group, and these are the semi-tendinosus, semi-membranosus, biceps femoris, the long head, and the ischial head of adductor magnus, plus one more muscle is the short head of biceps femoris. And then nerve supply is the tibial, is basically the sciatic nerve. Okay, it's basically the sciatic nerve, but if they have to be included in the hamstring group, they are supplied by the tibial nerve, and that supplied the short head biceps femoris is supplied by the common peroneal nerve. Okay, so coming back, the arrangement of structures attached to the linea aspera. Now this is an important 1 mark question, or they may be asked in your vivas. Now what is the linea aspera? It is basically, if you've studied your upper limb, we have the bicipital groove. Yeah, in a similar manner we have this feature in the femur bone, and that is called the linea aspera. Now the linea aspera provides origin for a number of structures, and we have to know the order. Now from medial to lateral we have 8 structures. Okay, I'll just go through the names now, and I'll give you a hint on how you can remember these. So we have the vastus medialis, the medial intermuscular septum, which is basically the structure that separates the each compartments. Next we have the adductor brevis and the adductor longus. Now number 4, the adductor magnus. 5, the short head of biceps femoris. 6, the posterior intermuscular septum. 7, the vastus lateralis. And 8, the vastus intermedius. Okay. So to remember that, okay, you just visualize the femur bone and the 3 compartments, okay, the anterior, posterior and the medial. So you're going to start from the medial side. Okay, let me just bring in this diagram. Your textbook has a better diagram. I'm just, for your understanding, I'm just using this. You just start from the medial side, so the vastus medialis, and make your way around to the lateral side, and finally we have the vastus medialis. In the same manner, we're going to go from the medial compartment to the from the anterior compartment to the medial compartment to the posterior and back to the anterior. So it's in that order that we've mentioned the structures. So again I'm revising: the vastus medialis, medial intermuscular septum, the adductor magnus longus and the adductor brevis longus and the magnus, then the short head of biceps femoris, posterior intermuscular septum, we are again back in the anterior compartment where we have the remaining 2 muscles, and that is the vastus lateralis and the vastus intermedius. Okay, so these are the structures attached to the linea aspera. Now this ends our discussion on the muscles of the thigh. Okay, so questions that may be asked is so many 1 mark questions. Nerve supply may be asked, or the origin of sartorius and rectus femoris. Then this diagram itself may be asked as a 4 mark question. And yeah, this is basically the questions from your exam point of view. Moving on, the the leg. So we've discussed the leg, that it is divided into the anterior, posterior and the lateral compartment. Okay, now the muscles. Okay, let's just begin the muscles in the anterior compartment. Okay, so to remember this, just remember we have the tibia and it's anterior to the tibia. So we have the first muscle is tibialis anterior, straightforward. Okay, now the next 2 muscles. Now the muscles in this anterior compartment, from here they move through the dorsum of foot and is inserted into the toes. And if you're going to look at its action, it's basically to extend the toes. So based on that, we have the extensor hallucis longus, which extends the great toe, and the extensor digitorum longus, which extends the remaining 4 digits. So these are the main 3 muscles in the anterior compartment. Apart from that, we have one more muscle, and that is the peroneus tertius. Okay, now the nerve supply in the anterior compartment is by the deep peroneal nerve. Okay, now I've included the table, you can go through that. Moving on, the lateral compartment of leg. Now you can remember easily. The lateral compartment has the fibula bone and the peroneus. The word peroneus basically is the Latin for fibula. So we have 2 muscles, a long peroneus and a shorter peroneus. So the peroneus longus and the peroneus brevis, and their nerve supply is the superficial peroneal nerve. Okay, and I've included the origin insertion. Now next is the posterior compartment of leg. Okay, now the muscles in the posterior compartment of leg, these are divided into a superficial group and a deep group. Okay, to simplify this study, it's divided into a superficial and a deep group. Now muscles in the superficial group, there are 3 muscles, and these are the most superficial is the soleus. Okay, soleus. Then we have the gastrocnemius muscle. Now the gastrocnemius muscle, as you can see in this diagram, it has a medial head and a lateral head. Okay, so it's a huge muscle that makes bulk of your thigh. So the soleus, the gastrocnemius, and finally a plantaris. Now the plantaris is actually, it has a small belly and the rest is actually a tendon. So you can clearly see this in your dissection. It is basically, it has a small belly and a long tendon. Now the small belly is seen in close proximity to the lateral head of gastrocnemius. Okay, so these are the muscles in the superficial group. Now what happens is, the heads of soleus the soles and the heads of gastrocnemius, they come together and they form a common tendon, and that common tendon is called triceps surae. Okay, the triceps surae, the common tendon, it gets inserted into the foot and into the posterior aspect of the foot, and this structure is called the tendocalcaneus or the Achilles tendon. Okay, so what is the Achilles tendon? It is basically the common tendon of the superficial muscles in the posterior compartment of leg that gets inserted into the tarsal bone called calcaneum, hence the name tendocalcaneus. So these are the muscles in the superficial group. Now the muscles in the deep group, you can just remember it like they are just the exact opposites of the muscles in the anterior group. So we have tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. And for one more muscle which is included in your knee joint, and that is the popliteus muscle. Okay, so the deep muscles are tibialis posterior, flexor hallucis longus, and the flexor digitorum longus, and one more, that is the popliteus. Now their nerve supply, these are supplied by the tibial nerve. Okay, so again I'll just go through. We have the anterior, posterior, and lateral compartments. Anterior compartment is the muscles are tibialis anterior, and they extend the toes, these muscles, so extensor hallucis longus and the extensor digitorum longus. Apart from that, we have one more, and that is the peroneus tertius. Okay, and on the lateral side we have two muscles, peroneus longus and peroneus brevis. And finally we have in the posterior compartment, we said that it is divided into the superficial and deep group. The superficial has three muscles, and they form the Achilles tendon and is inserted into the calcaneum. And the deep muscles are exact opposite of the anterior group of muscles, and these are the tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. Now the nerve supply. I have mentioned to you before that the sciatic nerve comes and divides into the sciatic nerve has two parts, the tibial and the common peroneal nerve. Okay, now the tibial nerve goes on to supply the posterior compartment. Okay, now the common peroneal nerve again divides into the deep peroneal nerve and the superficial peroneal nerve. Now the deep peroneal nerve, we've discussed, supplies the anterior compartment, and the superficial peroneal nerve supplies the lateral compartment. Okay, so these are the muscles and these are the muscles and their nerve supply. Now I've included the tables here as well. This is of the superficial group, this is of the deep group of the posterior compartment muscles. This is the lateral, and we've discussed that. Okay, moving on. This diagram, there's a better diagram in your textbook. It is not commonly asked as a 4-mark question, but then the chance of asking, is not there. We don't want to miss anything when we're studying it, right? So I'd say you give importance to the cross section of thigh, and if you have time, and if you have time, you can just go through this diagram as well. Now the one more thing I want to discuss is the fascia lata. Now from an exam point of view, fascia lata may be asked as a short note, that is for 4 marks. Now what is the fascia lata? It is basically a deep fascia of thigh covering it like a sleeve. Okay, now when it's asked for your exams, the points that you must include are, basically you can as an introductory point say what the fascia lata is. That is, it is the deep fascia and its attachment. Okay, you have to mention this in your exams, in your answer sheets. So the attachment. Now just visualize the pelvis bone in your mind and take a blanket. Okay, now I'm gonna pin parts of the blanket to the pelvis to form a sleeve. Now what we're gonna do is, superiorly we are gonna attach a pin to the anterior superior iliac spine, the inguinal ligament, and the pubic tubercle. Okay, I'll just go back to the first diagram. Oh, wait. Okay, you see this here. So I'm going to put a pin here and the pubic tubercle and the ligament between these two, that is the antisuperior iliac spine and the pubic tubercle, is the inguinal ligament. Okay, so that is what I've drawn here. So these are the first two pins that we're going to attach superiorly. Now next, laterally, so we have the iliac crest laterally. Okay, you're gonna I want you to visualize this in your mind and then like go through this with me. So superiorly we have, superiorly, or we can say anteriorly, we have the anterior superior iliac spine, inguinal ligament, and the pubic tubercle. Laterally, the iliac crest. Posteriorly, what do we have? The sacrum and the coccyx, and there's a ligament related to them, and that is the sacrotuberous ligament, which will be discussed later on in detail. Next, medially we have the pubis, pubic arch, and the ischial tuberosity. So these are the pins on top. Now you're going to go bottom, and on the inferior side we just attached it to the front and sides of the knee. So this is basically attachments of the fascia lata. So visualize a blanket and visualize your pelvis. Anteriorly we're going to attach it to the anterior superior iliac spine, pubic tubercle, and the ligament in between them, that is the inguinal ligament. Laterally we have the iliac crest. Posteriorly we have the sacrum, the coccyx, and a ligament called the sacrotuberous ligament. Medially the pubis and the pubic arch and the ischial tuberosity, and finally inferiorly the front and sides of the knee. So these are basically attachments. Now another commonly asked question is, what are the two modifications of the fascia lata? Okay, so if it is asked as a short note, we have to include in your answer the attachments and the two modifications and a bit detail on the two modifications. Now the first modification we're going to discuss is the iliotibial tract. Now the iliotibial tract is basically the thickened lateral portion of the fascia lata. Thickened lateral portion of the fascia lata. Its attachment, if you see this diagram here, it is attached and superiorly to the iliac crest and the capsule of hip joint, and inferiorly it is attached to the lateral condyle of tibia. Okay, so the iliotibial tract, it is a thickened lateral portion of the fascia lata, and its attachments are the iliac crest and the lateral condyle of tibia. Now another one more question within this that can be asked, and that is commonly asked in your exams, is what are the two muscles that are enclosed or that are enclosed by the iliotibial tract? And these are the gluteus maximus and the tensor fascia lata. Okay, now in your answers, apart from this, we have to include an applied anatomy. Like you have to write the heading applied anatomy and give a few points in your answers, and there we can say the function importance of the iliotibial tract, which is to stabilize the knee joint laterally. It is present on the lateral side and hence provides extra stability to the knee joint when during extension and partial flexion. So it is constantly used during running and walking. So this is basically about the iliotibial tract. Moving on, the saphenous opening. Now to visualize the saphenous opening, it is basically you take a piece of paper and roll it on itself to make a loop or to make a hole. So in the same way, the fascia lata folds on itself to form an opening called the saphenous opening. Now the surface marking is also asked in your anatomy practical. It is basically 4 cm below and lateral to the pubic tubercle. Okay, let me just bring in that diagram. We have this here is the pubic tubercle. Oops. This here is the pubic tubercle. 4 cm below and 4 cm below and lateral to the pubic tubercle. We have the saphenous opening. Okay, so that is about the surface marking. So you have to remember it for your practical anatomy practicals. Now other points that you can include is, because it is a folding on itself, it has a well defined lateral margin and an ill-defined medial margin, and it is covered by a cribriform fascia. Now the word cribriform is used when something has so many holes in it. So basically this structure is porous. You can say it is like a sponge. So it is called cribriform fascia. So it is covered by a cribriform fascia. Now what opens into the saphenous opening? Now the important structure we must remember is the great saphenous vein. Okay, the great saphenous vein in and itself is an essay or a short essay which is asked for 8 marks, and we'll discuss that later on. For now, remember, structures that open into the saphenous opening are basically veins and lymph nodes. So we have the important vein, that is the great saphenous vein, and superficial epigastric vein and superficial external pudendal vein. These are basically tributaries of the femoral vein. Okay, which is discussed in the next topic, that is the femoral triangle. For now, just remember the great saphenous vein opens into the saphenous opening and few lymphatics as well. So this ends our discussion on the fascia lata. So if it is asked for your exams, you have to first give what the fascia lata is, a brief introduction, then its attachments, then we move on to the modifications, the two modifications, the iliotibial tract. You can talk about the attachment and the function importance of the iliotibial tract, and the saphenous opening. You can include this diagram. See, every answer in your anatomy paper must have a diagram, or every question you must answer it with a diagram. So whatever diagram you can think of, you can make it in that point, or just make a diagram. So in this answer you can include the saphenous opening diagram. You can talk about its surface marking, and the applied anatomy is basically studied later on, that is the varicose veins and the femoral hernia. So we'll discuss that later on. For now, just remember the that it is the unfolding of the fascia lata on itself, the surface marking, and the structures that pass through the saphenous opening. So this ends our brief overview of the lower limb.